Hello, everybody. This is Dr. Kamel with a new content about physical therapy license preparation. And if you didn't see any video for me before, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I'm a licensed physical therapist in the United States, in the UK, and also in Egypt. I have got my PhD from University of Nottingham from the UK. So let's go quickly to our new content today. A patient with Parkinson disease has just been admitted to the rehabilitation unit. The patient is dependent in all transfers and requires moderate assistance of one person to walk 30 foot, which is about 9.1 meters, with a standard walker. To facilitate good carryover for activities, instruction for the family in transfer should occur. Okay, so let's break down the case. The case is Parkinson disease, and it is one of the neurodegenerative diseases which is affecting the basal ganglia of the brain and has different types of manifestations, include abnormal gait, fascinating gait, tremors, abnormal muscle tone, rigidity, stiffness, problems with balance, problems with coordination, cognitive problems. So you know that Parkinson disease has different stages. So it looks like our patient today at late stage, we can say, because the patient is dependent, means that he needs almost everything to be done by caregivers, you know, in transfers, and require moderate assistance of one person to walk around 30 foot, but using assistive device, standard walker. Okay, so for walking, he needs moderate assistance from a caregiver in addition to use of assistive device or a standard walker. Okay, so the patient was in a rehabilitation unit, and it looks like the patient will be discharged from the rehabilitation unit going home. And as physical therapists, we need to plan this in advance in order to facilitate good carryover for activities. So it means that the patient, with the assistance of the family, will be able to continue doing the home exercise program at home. Not only that, we need to instruct the family in transfer in order to make sure that the transfers are safe without the possibility of having any falls or any injury or whatever. So, how this can be done? Number one, during a home visit after the patient is discharged, I should give these instructions. After the patient is already home and I am visiting the patient at home for home care physical therapy, and during the home visit, I can give these instructions, or just prior to discharging the patient, so the patient before the patient leaving the rehabilitation unit, just prior to the discharging of the patient, I need to give these instructions early in the rehabilitation program during the patient's stay in rehabilitation unit when the family feels ready to take the patient home. So now they telling you that it is a sole decision of the family to take the patient home. Depending on what, we don't know. So what is the correct answer for this question? So the correct answer is early in rehabilitation program. We always plan rehabilitation. We always plan physical therapy. So when we are setting goals for our patient, we need to look in advance. We have short-term goals, long-term goals, and we bear in mind that this patient will not stay in the rehabilitation facility forever. So the patient basically will be going home later on, and how we can set the environment, how we can train the caregiver to take care of the patient on the next step. So we need to plan this early in the rehabilitation program. So teaching and involving the family early in rehabilitation process is essential for patients with Parkinson disease. Okay, especially if I am telling you that this patient is delayed or late stage Parkinson, especially when the patient is highly dependent in mobility and transfer. Early family education actually will allow the caregiver to observe, learn, and practice. So, three components: observe what you are doing, learn from what you are doing as a physical therapy, and practice this may be in front of you. So, to make sure that these safe transfer techniques alongside the rehabilitation team will be carried on during, later on during home stay. Okay. So if the family they feel that they have got this enough learning and practice, they can carry over these skills. They will have consistency in the patient care during stay in the hospital, rehabilitation facility, later on at home. Okay. And we know that Parkinson's disease is a progressive disease. It means that the patient will be deteriorating, even if the patient is getting the best medical and physical therapy care. Okay. So, what will happen? The patient mobility and transfer might change over time. Okay. And we need to teach early on the family and caregivers, so they will have the confidence in carrying over these activities. Not only that, they can also ask questions while supervised, and you can give answers, you can give training, so you make sure that they are safe and they can handle the patient later on. Okay. So one of the goals for these progressive diseases or non-curable diseases is caregiver training. Okay, as soon as this is feasible or they can do it. Okay, I will not wait until the patient is going home and then I will start that. I will not wait until the patient is ready to be discharged and I am starting that. I cannot wait to do that. I have to do that early on. Okay. So let's give an example. A family member learns how to safely assist with sit to stand. One sit to stand transfer, one of the most difficult transfer activities for seniors and for people with Parkinson. Okay, how they can handle walker use on level and unlevel floors and situations. Okay, so this can be done during physical therapy sessions early on. So later on, the family will get this confidence. They will not be feeling overwhelmed with, the practice and of these activities with the patient later on, because you will not be there all the time as a physical therapist. They will be dealing with the patient by themselves. Let's look at the incorrect answers. Number one, during a home visit after the patient is discharged, incorrect. Okay, waiting until the patient is discharged is, will delay critical learning. Okay, will not give the family enough time to do supervised practice. Will increase the risk of injury. The patient, the family might do improper technique in using assistive device or in assisting the patient to transfer from sit to stand or for ambulation activities. So no, no, this will not ensure safe and independent carryover. Okay. Number two, just prior to discharging the patient, this is incorrect because there will be too little time The family will feel that they are unprepared or anxious, actually. They will not gain enough confidence, and this might affect the safety and later on. Number four, when the family feels ready to take the patient home, this is incorrect, actually, because this will delay the participation, and this give you the feeling that it is a sole decision of the family to take the patient home, although this is a decision which is usually taken by caregivers or not, I mean, a physical therapist, physician, everybody involved in the patient care. So, as a therapist, you should guide when and how education occurs, and I cannot leave that for the family subjective readiness when they feel like doing it. No, it doesn't work this way. Okay, so to summarize all what I said, the family should be involved in all stages of planning and treatment. A family involvement can shorten the rehabilitation process and facilitate patients return to the community as soon as possible. So I would involve the family early on in rehabilitation, in advance before discharging the patient home. This was the answer of today's question, and it is, important to understand the rationale of the question and what is the purpose of the material as well. If you are planning to join my BT license preparation course, please drop me a message on 001. This is my WhatsApp number, 001 or 00201027743702. And if you are planning to join the transitional DBT or the post-professional DBT from the University of Montana in the US, which we can get you a very good discounted rate. Please, give me, or send me a message on these WhatsApp numbers, and I will give you all the requirements for the application. So it would be an easy process for application and admission. Yeah, so please subscribe to my channel. Encourage your colleagues to subscribe to the channel. And until I see you in very soon in a new content. Thank you.